Medurstand. Understanding medicine.
Welcome to Medurstand. Ladies and gentlemen, this is the third of the series of interviews on different aspects of hepatitis and related disorders. We covered hepatitis C in detail, and then we covered hepatitis B in detail. And today we're going to cover another very, very common condition which is emerging, which is not infective, but it is coming as an epidemic. And we again have our expert, Professor Aftab Mohsin, who has been principal Gujranwala Medical College, principal Rashid Medical College, professor of medicine in various government institutions, and he has also been chair of hepatitis control program. Professor Aftab Mohsin, welcome to Medurstand.
Thank you, sir. I'm very grateful for your kind invitation.
We are seeing a lot of what we call non-alcoholic fatty liver disease. Can you tell us what is this condition and why it has become so common in our country?
The world is seeing an emergence and surge in NCDs, and the most common part is diabetes and obesity. And along with comes heart disease and hypertension. And then we have metabolic syndrome, which is a combination of being overweight and have hypertension, high blood pressure, and insulin resistance and diabetes. And along with that comes ischemic heart disease, but follows the liver disease, the metabolic associated fatty liver disease, or NAFLD, non-alcoholic fatty liver disease. And now all the various societies like the European Association of Study of Liver Disease, American Association for Study of Liver Disease, and the Asia Pacific, as well as the Pakistan Society of Hepatology, they also connected with me, and they are having a dialogue now, and they want to club these as steatotic liver disease. क्योंकि वो कहते हैं नॉन अल्कोहलिक से इसको स्टिग्मा लग जाता है, जैसे अल्कोहल का कोई ताल्लुक है इस पेशेंट के साथ. हालांकि कह रहे हैं नॉन अल्कोहलिक, वी आर सेइंग नॉन अल्कोहलिक, बट पीपल स्टिग्मेटाइज इट, एंड नाउ इट इज गोइंग टू बी कॉल्ड steatotic liver disease, SLD. So it's very common, and we see its prevalence about 50% of people in adult population. That's very, very high, sir. And in Pakistan, there is one category called lean NASH, non-alcoholic steatoliver disease, steatohepatitis, or metabolic associated steatohepatitis, which occurs without obesity. So lean NASH is also very common. So This has become number one cause of liver transplant in 2021 and beyond in USA. Previously, it was hepatitis C, which was the commonest cause of liver transplant, or it was alcohol-induced liver disease in certain parts of the world, like France and UK. But now, this steatotic liver disease has become number one cause, and it is the most prevalent disease of liver in the world as we speak today, this morning.
Right. Since our audience is mostly healthcare professional, can you tell us the diagnostic criteria? How do we establish the diagnosis of non-alcoholic fatty liver disease?
That's a tricky question, because the gold standard for the diagnosis of steatotic liver disease is a liver biopsy, whereby you determine the content of fat in the liver. In a normal liver, the fat should be less than 5%. When it goes beyond 5%, then it becomes steatohepatitis or steatic liver disease. So there's a difference, non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. Steatohepatitis means inflammation, and steatotic liver disease means fat, inflammation, fibrosis, and cirrhosis, and it can ultimately end into HCC. So that whole spectrum is SLD. And when it goes beyond 5%, it can cause this. Liver biopsy is still the gold standard, but people don't get liver biopsy. So
Right.
what we do is that we uh, investigate the patient for common causes and make it as a diagnosis of exclusion. Now there is one test which is non-invasive, shear wave elastography, and you can measure the content of fat, but you cannot measure inflammation. And there is this computerized attenuated score from which you can measure the CAP score, measure the fat content in the liver, and it measures into mild, moderate, and severe. 5 to 10%, 10 to 15%, and 15 to 20% or beyond, which is severe. So 20% of liver can actually be fat, and it is assumed that when it is more, there are more chances or greater chances of inflammation. When inflammation is there, it will lead to fibrosis and cirrhosis and HCC.
Right. So
And
mostly
like
we
hepatitis
measure
B,
the patterns of fat on ultrasound. Is CT scan or MRI or this fibroscan better than ultrasound?
yeah, definitely shear wave elastography is better than ultrasound, and MRI is better. But those MRIs are special MRIs, and they have to be done on very high resolution machines. But they are very expensive ones. So
Right.
MRI is the most superior, non-invasive test for detecting concentration of fat.
Hmm.
Steatohepatitis is still diagnosed when you have ALT, AST raised, and you have excluded common causes like hepatitis B and hepatitis C, and in certain young people, Wilson disease or hemochromatosis, then you can make a diagnosis.
Right. So ALT may be elevated in people with NAFLD, but when would you say that it has gone into stage NASH? Patient has got developed steatohepatitis. Is there any level of ALT which can tell that this is now
Normally, we say that it is NASH once ALT is elevated. We presume that it is NASH, and it is
okay?
not
So even little
simple.
bit elevation means that the patient has got NASH.
Yes, especially the standards which we are using as normal,
Mhm.
they are very high standard because American Association for Study of Liver Disease, they have said that normal ALT for women is 19 international unit per liter, and for men it is 30. In most of the labs which we follow in Pakistan, they say normal range up to 45. So when it is 45, for a woman, it is already twice the normal according to AASLD. So I think that if even if it is 1 unit raised, we should take it as a sign of inflammation, especially in women. And in men, there is a range, obviously, but you should consider a raised ALT as a sign of steatohepatitis and a normal ALT as a sign of NAFLD. But this is not 100% because the gold standard is only liver biopsy 2 days.
Right.
Sometimes you have to do it.
After establishing the diagnosis, is there any treatment,
Yes,
lifestyle changes or medication? Can you highlight the treatment part, please?
yes. The most important is awareness of the person that he has got metabolic dysfunction associated liver disease. Metabolic dysfunction associated liver disease means that there is a combination of being overweight, high blood pressure, insulin resistance, and they can only be dealt with by therapeutic lifestyle change. So, a lifestyle change has to come. The person
Hmm.
should start walking more and start eating less and should remove too much desserts and too much fried food and lose weight. No matter what weight you are, if you lose weight, your metabolic dysfunction associated liver disease will get better. So that
Right.
is for one. Then there are two medicines that have been approved by FDA for uh, this NAFLD, NASH, or steatotic liver disease, SLD. That they are one is pioglitazone and the other is alpha tocopherol, vitamin E. So there are two medicines that are there. And then now we know that GLP-1 receptor analogs, they are effective. Liraglutide, semaglutide, they are effective for fatty liver disease. And we also know that this new drug, ursodeoxycholic acid, uh, that is also effective. That is like ursodeoxycholic acid further development ursodeoxycholic acid. And there is a trial going on in West with the dose of 10 milligram and 25 milligram. The results are not out yet. It will be completed in 2025. It's still not recommended, but the off-label use is there with ursodeoxycholic acid. So three medicines. Ursodeoxycholic acid is available in Pakistan also. Vitamin E, pioglitazone, and ursodeoxycholic acid. Off-label ursodeoxycholic acid. And then we have lifestyle change.
Right. So with lifestyle changes and these medications, should we expect fatty liver to reverse, or does it stay, doesn't progress? What should be our expectation with this treatment?
Now, this is a very dynamic stage. This fatty liver disease can go to steatohepatitis, and then it can go to cirrhosis. But with this, 60% of people from steatohepatitis can come back to fatty liver disease and can actually become normal. So this is a very fluid and a dynamic state. People are moving from one category to the other depending upon the content of fat that is in the liver. And that is not the full understanding. Some people have a very high CAP score on shear wave and very high fat content, but do not have any inflammation or evidence of cirrhosis. On the other hand, once you develop cirrhosis, the fat content goes down. And in those patients, stage or going toward end-stage liver disease because of steatohepatitis, once the inflammation gets converted into fibrosis and cirrhosis, the fat content naturally, even with liver biopsy, you cannot tell. Okay, this is the end result is because of some hepatitis, some metabolic abnormality like hemochromatosis or Wilson disease, or it is autoimmune liver disease, or it is NASH. So at that stage, all becomes equal.
Right. So do you see any role of bariatric surgery or any other kind of metabolic surgery on this NASH or CLD, metabolic liver
Metabolic
disease?
surgery, yes, but it is not indicated for the treatment of metabolic associated liver disease. It is indicated for very high BMI. And I am not one of those people who will recommend this surgery very easily. I would now use proper dose of semaglutide, and I have used Monjaro, which is another drug, is available, and that is very
It's not
effective.
available in Pakistan, is it?
It's not available, but you can have it
Oh,
made available.
all right.
So it's GLP-1, GIP agonist. It's a dual agonist. So it has a role, yes, but it
First, I
can be
think
only offered to very few.
first we have to try lifestyle changes, and those who fail to achieve their goals with lifestyle changes, they may opt for bariatric surgery. Of course, we understand it's a major surgery with some complication. It's expensive surgery. Everybody cannot have it. And we have limited facilities for this surgery also in our country, I believe.
And Paris, this lady now declared as the cause of death complication of bariatric surgery for Elvis Presley's daughter, the rock king of US.
Right. So
It's not with
that concludes our third episode and also the series on the liver diseases. Thank you very much, Professor Aftab Mohsin, and thank you everybody for watching this video. Thank you.
thank you so much. Very good.